Welcome to the Facebook live session. Today our topic for discussion is seizures and epilepsy. What do you need to know? And for our discussion, we have with us Dr. Deepika S, consultant Neuro Physician at Apollo Hospitals, Hyderguda. She is a senior consultant, has been with Apollo since 2014. Expert at treating, she is in stroke, seizures, epilepsy, Parkinson's disease and dementia. Dear viewers, if you have any doubts regarding today's topic, seizures and epilepsy, please leave them in a comment section. Doctor will answer them during the session. So let's start our today's session. Namaste, doctor.
Namaste.
The question is, what is the seizures and epilepsy?
Seizures are a medical condition whenever they happen whenever there is a sudden electrical disturbance in the brain, which usually is manifested by presence of sudden jerky movements in the limbs of the patient. Patient can sometimes lose consciousness. There can be a tongue bite. Patient can pass involuntarily urine or bowels. Bowels can be opened. So these are some of the symptoms seen in seizures. Now epilepsy, seizures in general language, in local language they call, sometimes it's called fits also in non-medical terms. Epilepsy is a condition where the seizures happen repeatedly.
What are its symptoms and types?
Normally seizures can be known to be of two types. They are either partial seizures or generalized seizures. Generalized seizures are what everybody, common public also knows, where the patient suddenly loses consciousness, falls to the ground, has violent jerky movements of the limbs, and they can lose urinary control. They pass urine, sometimes pass motions, they have a tongue bite, and they take around 15 to 20 minutes to recover. These are called generalized seizures. There are something called partial seizures, in which the patient may not fall to the ground, may not completely lose consciousness, but there will be lapses in awareness. Patient will have a lapse of memory. Sometimes patients can just stare into the space. They can have small involuntary movements of the hands, some automatic movements like lip smacking or repetitive hand movements. And sometimes patients can get a vague sense of fear, and sometimes will just sit without any movement for a few seconds. These are the partial seizures types.
What are the causes of seizures, doctor?
Normally seizures can be, they can have a cause. Sometimes just low blood glucose can trigger seizures, low sodium, some viral infections, brain infections like meningitis or encephalitis, head injuries, presence of any tumors, they can also trigger seizures. Now sometimes seizures can happen without any underlying condition, that's called idiopathic, and when the seizures are idiopathic, that's when we call that the patient is epileptic. That is, they tend to have multiple repeated seizures without an underlying cause.
What is the difference between the epilepsy and seizures?
Just like I mentioned just now, epilepsy is a condition where the patient has at least 2 or more episodes of unprovoked seizures. Unprovoked seizures means the provoking factors in such cases will be usually a low blood glucose, low blood sodium, or a presence of head injury or an infection which can trigger the seizures. If these triggers are not present and the patient gets a seizure without any triggers like these, provoking factors like this, it's called epilepsy. Now epilepsy is a disorder and it can usually last a lifetime.
Can you please explain about the treatment of seizures, like a first aid, long-term treatment and duration, doctor?
Usually whenever a patient gets seizures, it's the first aid which is the most important, and there are lots of misconceptions about this treatment, about the first aid management in a seizure. Any seizure usually lasts for less than 5 minutes. So the usual violent movements all stop within 2 minutes. So during this period, the main focus should be to avoid injury to the patient. So whenever you see a patient having seizures or getting seizures, you need to first protect the patient's head, turn the patient to the side to avoid his own secretions being aspirated, turn him to one side, whichever is feasible. Try to loosen anything around the neck like a strong tie or any tight shirt collar, so that there won't be any choking for the patient, and then wait for 2 minutes. The seizure usually subsides by that time. If the seizure doesn't subside in 2 minutes, it's an emergency, then you have to take the patient to the hospital. So, during this first aid, there are a lot of misconceptions, like they try to put the keys in the hands, some people try to make the patient smell onions, sometimes even slippers are made to smell. So, these are all misconceptions, they have absolutely no use at that particular point of time or any time in fact. So, the main precaution will be to protect the patient's head, prevent head injuries, prevent aspiration by turning the patient to this side. And then this is about first aid. Long term treatment, any seizure patients or epileptic patient requires usually 3 to 5 years of treatment, and this treatment can be lifelong in some patients depending on the situation and the patients respond to treatment.
What is the seizures management in a pregnancy, postpartum and lactation?
Usually pregnant women, the drugs which we use, the medicines which we use in pregnant women are little different from what we use in general population. There are 3 to 4 drugs which are considered to be safe in pregnancy. So, these are the ones which we prescribe in pregnant women. If the woman has been already epileptic and is on some drugs before conception, so if the patient is planning to get pregnant, it is better to visit the neurologist to check whether these drugs which she is already using are compatible with pregnancy. So, if we feel that patient is on drugs which are not suitable for pregnancy, we try to shift the patient to drugs which are suitable in pregnancy, and then when the patient is seizure free for 9 months, they are advised to go ahead with conception. Just like in pregnancy, even in lactation, there are some drugs which are safe and unsafe. So, you have to definitely meet the neurologist to decide whether the medicines which you are already using are safe for the child during breastfeeding.
Could you tell us about stigma regarding the illness and need for awareness of this disorder?
Usually in rural India especially, seizures is considered as some sort of a possession by an evil spirit. They think that an evil spirit has possessed the patient and that is why the patient seizes. So, this is something which has been going on since ages, and even now there are some areas in rural India where they think that it is a temporary possession of evil spirit, and sometimes patients get even treated with a local walk where they quack, where they try to use all sorts of physical injury also to stop the seizure from happening. So, this is something which is still going on in some deeper rural parts of India. Now the situation is little better than it used to be before, with increasing social awareness, social media presence even in deeper parts of rural India, but still I think there is a lot of need for us to work as organizations where we can spread health awareness about seizures right in the nook and corner of rural India.
What are the side effects of medicines and need for a regular follow-up?
See, usually the problem with the compliance is following the drug treatment. Usually, like any other medications, even anti-epileptic, that is seizure medications, are associated with some side effects, like patients usually can complain of weight gain, excessive sleepiness, they can in some cases they lose appetite, sometimes they can have behavioral problems, they will feel low in mood, or sometimes they can get aggressive. These are some of the side effects. So, but then these side effects shouldn't stop the patient from continuing the therapy. For every side effect there are alternative medications where we can adjust the dose, change the medication as per the patient's reaction to these medicines. So, this is the first need for counseling the patient is very important. This is where the counseling becomes important, because side effects are known, they will be there. So, but awareness of these side effects and when to approach your doctor for a follow-up rather than stopping the medications is key. So, we need to counsel the patients about the side effects so that they can come back to you and tell you that these are the side effects and they do not like these side effects. So, then we have the option of changing the medicines and using a different set of medications.
It's very informative session, doctor. Last question. Please tell our audience about neurology department at Apollo Hospital, Hyderguda.
Neurology department in Apollo Hospital, Hyderguda has state-of-the-art neurology equipment right from EEG, ENMG and MRI. We treat all sorts of neurological disorders ranging from stroke, Parkinson's, dementia, seizures, meningitis, and our long-term neurological outcomes are also on par with the international institutes.
Thank you, doctor, for educating our audience in today's session. Thanks for joining us. Stay tuned for more such educative live sessions. Stay safe, stay healthy. Namaste.